I'm Laurie Cuttino. I am the radiation oncologist and the medical director of the oncology program here at Sarah Cannon at Henrico Doctors Hospital. And I thought I would show you all a radiation treatment room and talk a little bit about the technology that we use here to treat cancer patients. So first of all, this is the treatment room. This is our radiation machine. We have two. This is called a linear accelerator. It generates high energy X-rays, which then go on to kill cancer cells. The machine has a couple of different parts to it. This is called the gantry. This actually moves around patients while you're being treated, so nothing actually touches you during a treatment. This just moves around you. Radiation is invisible and painless. You do not feel or see anything during a treatment. This is where the radiation actually comes out of the machine. And this is how we take pictures of patients prior to treatment to verify that we're treating accurately. This is actually capable of doing a rudimentary CAT scan right here in the treatment room, so we can actually do what's called image-guided radiation therapy, which means that we always know exactly what we're treating because we can actually see your internal anatomy in all three dimensions prior to delivering a treatment. Pretty cool. Many patients ask if we do IMRT. That stands for intensity modulated radiotherapy. We absolutely do. Intensity modulated means that we're actually varying the shape of the radiation beam as it comes out of the machine. We do that because the head of the machine has a whole bunch of different tiny metallic leaves which actually move during treatment, and we can come up with basically any size or shape of radiation beam that we need. That means that we can maximize the dose of radiation to the tumor, but we can minimize the radiation dose delivered to all of the normal structures around it. And that really means that we can achieve cure rates that are much higher than we were able to achieve in the past because we can increase the radiation dose without increasing side effects. All good stuff. We can also do what's called VMAT. That's basically a modern version of IMRT. That stands for volumetric modulated arc therapy. What that means is the gantry is going to be continuously moving in a 360-degree arc or circle around the patient. And that means that we can deliver IMRT even faster. Typically, treatments take less than 2 minutes. So most of the time a patient spends in the treatment room is actually us making sure you're positioned properly, taking pictures, and then we make adjustments so that everything is lined up to within half of a millimeter in all directions for most treatments, or if we're getting really fancy, if we're up in the brain, less than a tenth of a millimeter in all directions. We're able to make those adjustments because patients are lying on this carbon fiber table. We call that a couch. This particular table or couch is a 6 degree of freedom couch, which means it can move in 6 different ways. So it can go up and down, it can rotate, it can pitch, it can do all sorts of really neat things. And what that means is once we've taken the pictures of you, once we've done whatever imaging that we're doing, we can compare the way the patient is positioned to the way the patient is supposed to be positioned. And then in about a second or so, the computer will tell the table that you're lying on how you need to move so that everything is aligned perfectly. Then, once everybody is satisfied, this is going to go around you in a circle, and it's going to deliver everything in typically less than 2 minutes, sometimes even faster than that. So that's VMAT, or volumetric modulated arc therapy. We use also a lot of what is called stereotactic ablative radiotherapy. That's also known as SABR. It's also known as SBRT. It all actually means the same thing. That's where we're using a really high dose of radiation that's delivered over a very short period of time, usually to a small target. We use that to cure small lung cancers. We use that to cure early stage prostate cancers with very, very, very high degree or rates of success. And we also use it kind of most excitingly in patients who actually have stage 4 cancers, but they have a special type of stage 4 cancer called oligometastatic disease. And what that means is their cancer has spread, but they only have say 1 to 5 spots of active cancer, we can actually do a really high-dose targeted radiation treatment to each of those spots. And sometimes we can put patients back into remission, maybe even without the use of chemotherapy in certain circumstances. I have a whole bunch of patients who are doing really, really well for several years at a time off of all systemic therapy because of that particular technology. We do a lot of that. In fact, Henrico Doctors Sarah Cannon actually is in the top 3 deliverers of stereotactic radiation for all of Sarah Cannon, and that is nationwide. Which leads me to the fanciest of all stereotactic techniques, Hyperarch. Hyperarch is a relatively new, super exciting treatment for brain tumors, and it has been a game changer for patients with brain metastases. So not usually primary brain tumors, but tumors that have resulted of spread of, say, a lung cancer up into the brain or a breast cancer up into the brain. In the past, when you had multiple tumors in the brain, you had to treat them one by one. You had to treat this tumor, then this tumor, then this tumor, and then this tumor. And that can take about 10 to 15 minutes per spot. So if you have somebody with 20 small brain tumors, in the past you could not treat them with stereotactic radiotherapy because it would have taken all day. Hyperarch is a game changer because Hyperarch uses these leaves to create tiny little holes. It almost looks like Swiss cheese in the head of the machine. What that allows us to do is treat all brain tumors that we can see simultaneously. So we can treat 25 brain metastases in less than 15 minutes, meaning that patients who were not eligible for the fancy type of radiation in the past now are eligible, and it's been phenomenal. And I'm very proud to say that Henrico Doctors was among the first 5 clinics in the entire United States to introduce this technology. We do a lot of it, and it's fantastically successful, and I'm really proud of that. That is just a brief overview of the technology that we use here to help cancer patients. Thank you so much for coming along.